also diabetes medications and acid-reducing medications. The diabetic medications, because turmeric has an impact on insulin as well. If you're taking a blood sugar modulating drug or an insulin-affecting drug, and you're also taking a turmeric extract of curcuminoid that affects your blood sugar, you could get it too low. The point is you could go hypoglycemic and end up dizzy, passing out, and you don't want to do that. So if you're going to start something like this and you're on those medications, let your doctor know and monitor yourself and be cautious. So at any rate, that's true of most drugs. Now, some of you might be saying, I want to do this instead of the drug. Look, I can't tell you to do that or to not do that. That's between you and your doctor, but use caution. Turmeric versus ibuprofen. So what we know about turmeric in terms of its ability to help with inflammation and pain, there have been a number of trials in humans that show it to be an effective agent at reducing pain. It has a cumulative effect, meaning the longer you're on it, the better it works. And it's generally well tolerated, meaning most people tolerate it over long terms without having severe side effects. It's also suited for chronic management of conditions. So if you're one of those, a chronic pain patient, and you've been given every medication under the sun, this is something that you could consider. It has a very potent anti-inflammatory effect, and it works in multiple ways. It affects multiple types of inflammatory cascade mechanisms. Ibuprofen is used to manage pain and inflammation. The difference between the two really is ibuprofen works much more quickly. Works within about an hour of use, and we could also say this of drugs like acetaminophen, it works quickly. And so, whereas turmeric works a little bit more slower to take effect, but more effective long-term. It has a cumulative effect long-term. It works better the longer you're on it. But one of the problems with ibuprofen is the gastrointestinal and cardiovascular side effects. Anytime you block cyclooxygenase, which is what this class of medications do, there's a potential for heart problems, and there is also a potential for an erosion of the GI tract lining. So this can affect your stomach, it can affect your small intestine, eroding the mucosal layer, leading to things like GERD or leaky gut. But also, there's some nutritional effects of ibuprofen. We know it can cause vitamin C deficiencies. We know it can cause folate and iron deficiencies as well. So if you're using this long-term for pain management, you might consider talking with your doctor about using curcuminoids instead, or turmeric instead, or in lieu of, or to reduce your need for ibuprofen. I've seen cases where we can take somebody who's maybe using 800 milligrams of ibuprofen, we get them on a good 1,000 milligrams of turmeric, specifically turmeric extract with high-dose curcuminoid in it, and now we get a month in, even sometimes faster, we can take that ibuprofen down from 800 to 400, and then from 400 to 2, and then from 200 to none. So it's one of those things we can use to wean, that I sometimes do use to wean, but again, you need to do that under supervision, ideally. So how do you supplement? There are lots of ways to supplement. As I've mentioned before, there's powdered spice. This would be the whole turmeric itself. And then there are extracts and over-the-counter teas that can be bought that generally contain curcuminoids. This is what most consider to be the primary active ingredient that has the antioxidant and anti-inflammatory effects. Now, I would argue this is the one that's the most well-studied, curcuminoids, but there are at least 8 other compounds in turmeric that have been shown to have anti-platelet, any inflammatory and antioxidant effects. So I believe that there's more to turmeric than just curcuminoids. That being said, most supplements focus here on curcuminoids. A lot of supplements also will add black pepper or as an agent to enhance the absorption. Curcuminoids are, and turmeric is a water-soluble agent that's not super well absorbed by the intestines, and so using black pepper, piperine, you'll sometimes see as an ingredient on a supplement label, enhances the absorption of these things. Now, there's some science that actually argues that we don't want all that turmeric to be absorbed. We don't want all that curcuminoid to be absorbed. That actually a big part of its effect and its impact is right there in the gut, right there on the microbiome, which is what I showed you earlier. Turmeric's or curcuminoids impact on bacteria, on yeast, on parasites, on virus, on biofilms. And so a lot of what we suspect a lot of its impact is right there in the gut. So we want to keep a good amount of it in the gut. We don't just want it all to absorb in the bloodstream, because the effect, remember, we've heard this saying, all disease ends and begins in the gut, and so we want a lot of that impacting the gut as well. So I would argue, and in my experience, because I've used both, I've used multiple varieties of turmeric extracts clinically and seen that the ones that work better, in my experience, don't have this, don't have the black pepper, the bioperine, if you will, but are actually a whole turmeric matrix. So you get the whole matrix with a certain percentage of concentrated curcuminoids, but you get the whole matrix of the turmeric. And there's actually been some research studies on this that I'll share with you as well. So one of those being, you can see here, comparative oral absorption of curcumin in a natural turmeric matrix. So this is like a whole food matrix versus just concentrated curcuminoids. And so you can see the acronym they're using here is completely natural turmeric matrix formulation, so CNTMF. The extent of absorption of total curcuminoids in the blood for the CNTMF was 6 times greater than volatile oil formulations and 5 times greater than phospholipids. So a lot of these formulations now that are coming out with these fat-soluble versions, you can see that the matrix, the turmeric matrix formulation actually is absorbed in a better way and can be more functional, but it also stays in the gut. There are a number of different other compounds beyond the curcuminoids that have been shown to stay in the gut and have that impact on the microbiome, which is also part of what we want. Now, dosing-wise, dosing structure, you can go, there are studies that show that it's safe up to 8,000 milligrams a day for several months. Now, depending on what you're trying to accomplish, I find it to be super effective between 500 and 1,000 for most people. And as I showed you earlier, especially as it relates to the inflammatory markers like CRP and ESR, the 500 milligram, those studies were actually 250 and 500 milligram doses, and you saw that 250 almost had the same anti-inflammatory effect as 500. So I generally like to start people within that 500 range up to as much as 1,000, depending on their responses. Again, if you're on any type of medicine, work with your doctor, make sure they know that this is what you're trying to do. Make sure there's no contraindications in what you're doing so that you keep it safe. Another thing to consider, as you should consider with any supplements that you're using, is the potential for contamination of other things that you don't want to get exposure to. And so this was a study done on contamination of different turmeric and curcumin products that contained things that weren't on the label. In this case, it was cassava starch, wheat, barley, and rye. And if you're gluten sensitive or allergic or reactive to cassava, that's going to be a major problem potentially for you. So you always want, if you're buying, you want to buy from a highly reputable company that has advanced testing in place, because researchers have found a lot of these products to be basically contaminated on purpose, meaning the manufacturer of the product will put fillers in, wheat fillers, to add bulk so that they can sell more of it. And that's problematic for those of you that have celiac disease or, non-celiac gluten sensitivity. These, obviously you want to avoid wheat, barley, rye, and other grains, and you don't want to get a hold of a product that you're trying to take that has anti-inflammatory properties, but then you're being exposed to that contaminant that has inflammatory properties. One of the other things to consider with turmeric is the potential for lead and other metal contamination. So if you're buying a supplement or you're even buying turmeric in bulk powder, this is one of the issues that we're seeing is the potential for lead and other metal contamination. So my advice, if you're trying to reduce your potential exposure to metals that aren't good and you're buying a supplement, it's not a bad idea to ask, do you do metal testing on your product? Because companies that do metal testing, generally they're doing that to protect you from getting a batch of this powder that's going to be higher in lead and have the potential to bring problems to your doorstep. And I can tell you, just working in the supplement world, in the supplement industry, not all companies are equal. Many companies don't test. Many companies allow higher levels of these contaminants into their products and sell them openly. So you definitely want to make sure, again, if you're buying it, especially if you're buying it for medicinal purposes for yourself, you want to make sure you're getting a good product from a reputable company where they do testing for gluten if you're gluten sensitive, testing for metals and other potential contaminants. So there you have it, crash course on turmeric. If you found this class helpful, let me know what you think in the comments below. If you've used a curcuminoid-based product and found it to be beneficial, chime in below. Maybe somebody watching and reading the comments below will find value in your positive story and your positive experience. Thanks again for tuning into Dr. Osborne's Zone. Hope you have a fantastic day.